Hello and welcome to the Capacity Building webcast. We have just a few announcements before we begin. The slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides button located above your slide window. Should you need technical assistance, click on the Help button. If your screen freezes or the slides do not appear to be advancing as they should, please try exiting and restarting the session, as it may be an issue with your connectivity. At any time, you can submit a question using the box at the bottom left-hand corner of the screen. I would now like to turn the call over to Jen McNeil so that we can begin.
Thank you, Russ. On behalf of the Canadian Breast Cancer Network, I would like to welcome you to the Community Capacity webinar. Before we begin, we have a couple questions for you to answer to give Mary Frances MacLellan-Wright, who's our speaker, a better understanding of the background and knowledge of this group. So you'll see a poll pop up on your screen, and if you could just select the answer that best represents your knowledge. I'll just give you a few moments to do that. And then I have one more poll question for our group today. So if you could again just select the one answer that applies to you. Thank you for completing those questions. I would now like to introduce Mary Frances MacLellan-Wright, who is our speaker today. She has an MA in Community Health Education, a BA in International Development, and she is an evaluation consultant at the Public Health Agency of Canada. She has been involved in research and evaluation in a variety of settings, academic, community, and government. She has authored several papers related to evaluation. Previous work that she has done has included working on health promotion projects in Scotland, West Africa, and Canada. She currently lives in Edmonton, Alberta. So Mary Frances, thank you so much for joining us, and welcome. I'll turn it over to you.
Thank you very much, and welcome to this webinar. It's my first time delivering a webinar, so bear with me. Today I'm going to speak about what this concept is, the definitions of community capacity, touch on why this concept matters, and then we'll go into the concepts with a little more detail to explore how they may relate to the work of Canadian breast cancer community members. And then I'll speak about a tool that we developed at the Public Health Agency to help both community members and ourselves with the concepts. So just a tiny bit of background of why I'm speaking about this topic. At the Public Health Agency of Canada, we realized that most of our programs were trying to build community capacity in some way, or we were funding community organizations to do that. But we weren't really sure how we would ever be able to document or even measure it. So we initiated a research project in 2003 that brought together Canadian academics and practitioners and policymakers to really look at the concepts in the literature and come to consensus on what this means in Canada and what it looks like. And so much of the information I'm going to share with you today comes from that research. So we'll start off with some definitions. And as an aside, you're welcome to send questions to me during the presentation, and we'll also save a bit of time at the end as well. So community capacity reflects the characteristics of communities that affect their ability to identify, mobilize, and address social and health problems. And it's really about that potential of a community to affect change. This is a real shift from a deficit-focused approach to one that builds on strengths, beliefs in inclusion. It reflects the value of critical reflection and the importance of building relationships and collaboration. And although today I'll focus on the health field, the value of community capacity has been documented in other areas, including crime prevention, economic development, children's services, disaster management, marine protection, and more. And I'll be using the term community throughout, and wanted to clarify that my definition of community includes both communities of interest. So, for example, people in one province who were all interested in taking action on breast cancer, and also geographic communities. So it could include a neighborhood or residents of a city. So I use the term to reflect both aspects of community. So we're going to look at a few more definitions just to get a better sense of what this term is about. So Penny Haw summarized sort of three key dimensions of community capacity as being an approach to developing sustainable skills in individuals, organizational structures, and resources, commitments to health improvement. And this is an important definition just because it presents those three dimensions. But finally, this is my favorite definition because it explains that community capacity is not an inherent property of a particular locality or individuals, but it's really about the interactions. And it's a function of the resource opportunities or constraints of the conditions in which people live. And so, this really speaks to the importance of context when we think about capacity. And the important part here is to think about how community capacity is really about an interaction of the above. And so communities can gain and lose capacity. It's not static and often is cyclical. So why has this, forgive me, I have a little technical problem. Jen, can you push the next slide for me?
Yes, absolutely.
Why does it matter? Okay. Why has this concept been given so much attention? Well, first of all, it's an important concept because it allows us to address issues of relevance and power. And a capacity-building approach has the potential to support change in a way that the top-down behavior change models have failed in some disadvantaged communities. And for example, when we think of breast cancer prevention, treatment, and support, I'm sure you would all agree that there's a big difference between what we know is a good practice, but this knowledge alone doesn't change practice or policy. And this is, I'm sure, true for individual behaviors, such as food consumption and chemical exposures, as it is for professional behaviors. Just having knowledge doesn't seem to always change behavior. And community capacity is closely linked to a community's ability to really respond to those issues. And it seems that in settings where a capacity-building approach has been used, there's a greater chance of the initiatives being sustained and also enabling that community to respond to future health issues that arise or even non-health issues. A really interesting study was done by the International Federation of Red Cross and Red Crescent Societies in 2004. In their World Disasters Report, they examined several communities that had experienced disasters the previous year. They looked at things like the European heat wave, they looked at floods in developing countries, and they looked at the question of why seemingly similar countries had very different outcomes in terms of deaths. And they had identified that community capacity was the critical factor in determining how communities coped with the crises. So on to the next slide. I'm going to speak to an example just to illustrate this a little bit further. Back in 1990, Brazil had twice as many cases of HIV/AIDS as South Africa. And yet 10 years later, South Africa had 1 in 4, or a quarter of their population infected. And in Brazil, the infection rate had dropped to below 1%. So why was this the case? Well, according to the authors of Getting to Maybe, if you're looking for a charismatic leader who inspired people, you quickly realize there wasn't one. Instead, Brazilians at all levels, from government to local community leaders, joined forces in the service of a key guiding principle: no person, no matter how poor, insignificant, or illiterate, could be written off as beyond cure. Healthcare workers looked for ways to ensure treatment would be available to all. Volunteers from churches and other non-health charities worked alongside the clinical experts and became invaluable at helping people follow complicated drug regimens and learning ways to prevent infection. So if you were looking as well for a Canadian example of what this might look like in practice, the BC Healthy Living Alliance prepared a strategy that identifies community capacity building as a parallel goal to reducing tobacco consumption, improving nutrition, and physical activity levels. And this document, which you can find on the web, is a great example of the practical application of a community capacity building approach. So let's look at the concepts in detail. In the next section, I'm going to look at and break down the various dimensions of capacity, but I wanted to start here by emphasizing that communities are vibrant systems, and just as our body system is more than a collection of organs, community capacity is a function of interaction among a variety of elements, which I'll explore in the next few slides. Looking at this diagram, if we think of community capacity as the bright green center, we see that there are overlapping influences that need to be considered. And alongside, this isn't a linear diagram because the path of building capacity is not a linear one. It can be cyclical, wave-like, it'll have reversals, and movement forward, hopefully. So when we move on to the next few slides to break down the concept, I don't want to suggest that there's a formula or a recipe. So let's break it down and sort of look at individual concepts, and I'll invite you to reflect on your own work as we go through this. So probably the most important concept when we think about community capacity is that of participation. Participation is about people actively involved in improving the health and well-being of themselves or their community. And so participation means that the target population, or those you want to reach directly, the community members, or those you hope will ultimately benefit, and other stakeholders, such as your partners, are involved in project activities like decision-making and evaluation. So we're not just talking about showing up at an event, but true active participation in your work. And so thinking about what this looks like in practice, there's sort of two easy ways to slice it. One is to think about the who, which is those key organizations and your target population, and the how. And so thinking about who, you want to ask yourself, have you involved the right community organizations in your project or your network? And have you actively involved a representative range of the target population? For example, different sexes, ages, ethnicities, and sectors. And then thinking about the how, you might want to consider, have you overcome barriers to participation of the target population in your work? For example, has training been provided? Do they have transportation if needed? Childcare support if needed? Language supports? How about the location and the meeting times? I'm sure you've all thought lots about these things. And another dimension is, are you using different methods to inform everyone about the project? Examples include meetings, email listservs, the media, and newsletters. And I would gather from the experience that you have, Jen gave me a brief outline. I'm sure you're all well-versed in some of these important considerations. So let's move on to leadership, which is about developing and nurturing both formal but also those informal leaders during your work. Effective leaders support and direct, they deal with conflict and acknowledge and encourage community members' voices and share leadership. They facilitate networks to build on community resources. Leaders bring people with diverse skill sets together and have both interpersonal and technical skills. And finally, an effective leader has a strategic vision for the future. So that's really just a broad definition of what we mean when we're talking about leadership. But if we think about your work, have you had an opportunity to define the key roles and responsibilities of either the organization or the community leaders involved in the work? That's one question. Another reflective question might be, do you have reporting guidelines that ensure that leaders are accountable to the project team and the target population? And finally, what have you done to encourage and support the informal leaders? And I'm sure you've heard about the importance of informal leaders, the people who don't have a title, they may not be a part of an organization, but they're the people who have a lot of influence, or people just who have natural leader skills from the community who could be nurtured to become involved and supportive of the work. Okay, so I'm just going to poke my nose over into the Q&A section just to see if any of you have posted questions, but I don't see any yet. So that's fine. We're going to keep going through some of these dimensions of capacity. Another important piece are community structures. And community structures, when I looked at this and I thought about your work, I wondered if your networks would be considered a structure. I think they are. So let's read this and think about that. Community structures are smaller or less formal community groups and committees that foster belonging and give the community a chance to express views and exchange information. So examples are church groups, youth groups, self-help groups, and support groups. And these are those, they're not as formal, they're not as obvious when people think about who's going to help with problems in our communities. And yet these are often the first responders and the places where people get their ideas and they decide to take action and can really help support change. So thinking about the community structures, this next slide here just talks about some of those important aspects that you may come across when you're doing work and you're trying to build capacity. Some questions to reflect on are, have you developed links or partnerships with pre-existing community structures? And if you have linked with these kinds of structures, have you identified areas that your project work could improve the community structures that already exist? For example, maybe project management or policy development. And in some cases, projects or initiatives create a new structure that will allow people to come together. And that increases community capacity. And I'm if this is an interactive seminar, I would ask you if you thought your networks were an example of a structure that's been created to bring people together to find a common voice and take action. But my gut instinct from what I've read on your website, I think you probably are. So the next one we're going to think about are the funding bodies, or those external supports, like governments, foundations, health authorities that link communities to external resources. And sometimes, from my experience working on the funding side, I realized that there's actually a lot more you can get from those external supports than just money. And so this is just a list of some possible capacity building resources that are available. For example, project-related information. A lot of funding bodies have access to contacts, research, best practices, and new tools. And you might want to ask yourself to what extent you've been able to harness that from funders. Have you ever asked for project-related technical expertise from external supports, such as training, evaluation support, or financial management? Have you asked external supports for financial support for organizational operations for your project? And so this is really about getting diversity, trying to get multiple funding sources if possible to broaden your support base and improve your sustainability. And the last bullet there, reflecting on whether policies of external supports support your own work. It's important to reflect on whether or not external supports have policies that support your work, because, it's not just about individuals and organizations. Capacity also is influenced by those broader policies and funding environments. And sometimes pressure needs to be put in those areas in order to allow communities to mobilize. So that's sort of an outward-looking dimension of this category. Oops. So on to asking why, which is slide 19, if you can help us out, Jen. I'm just going to scroll down and see. Asking why. So asking why is a community process that discovers the root causes of community health issues and promotes solutions. The vision is that together the community critically assesses the social, political, and economic influences that result in differing health standards and conditions. Exploration through asking why can help a project or network reflect on community needs. And thinking about the breast cancer world, I was wondering to myself, are there specific populations that might have a higher incidence or mortality rate than others? And if there are, why might that be? Thinking about why is important because, as the authors of Getting to Maybe point out, how we think about and understand the world frames our actions. So on to the next slide. Slide 20. Have you had an opportunity to explore the root causes of issues targeted by your project? This might include lack of social support networks or barriers to accessing health services. And the question of asking why can be repeated. So if people are having barriers to accessing health services, well, why is that? And you can keep asking why until you feel like you've really reached the root causes. Have you had an opportunity to involve your target population in the process of asking why? And have you had an opportunity to engage them and try and find solutions to those root causes? These are some opportunities to sit back and think about whether there are, important issues that need to be addressed but perhaps haven't been so far. Or you may find that, in fact, you've been able to address them successfully and you feel like you've covered that well. So another dimension is obtaining resources. And obtaining resources here is meant to include resources other than what you would get from a funder. So this is really about, community fundraising, getting volunteers on board, making sure you have the information you need, and facilities such as meeting spaces, etc. And just to think about this a little bit further, you may want to ask yourself, do you have access to internal resources needed for the project success, such as community member skills and meeting spaces? But also, what about external resources? So maybe there are workshops offered by other, in other provinces or other countries. Are there additional sources of funding that you may want to think about? Sort of less traditional sources. Okay, so now let's talk about skills, knowledge, and learning, which is probably the most common. Whenever I do these presentations with people in front of me, I start off by asking, well, what people think of when they hear that word community capacity. And skills, knowledge is one of the first things that I hear people say. And it is really important that people have skills, knowledge, that they can apply to the issue at hand. And often when people gain skills and knowledge in one context or for one project, they can then apply them to the next thing they work on, and that's why it's such an valuable dimension. So thinking about your own work, there's sort of two ways, I guess. One is to find the people with the skills and knowledge you need, or to develop those in the project team and the target population. And something to consider is, have you had an opportunity to provide your target population and the community members with opportunities for learning? And are there other activities that you're doing to increase skills, knowledge, and learning? So the second last dimension that I'll talk about is linking with others, and this refers to connecting to individuals and organizations really the partnerships that allow you to connect to other entities who are also taking action in the community. And so some questions you could ask yourself about, how things are for your own work in terms of linking with others are you networking with diverse sectors to gain support for your project? Have you provided information to the link? And are you receiving information? So do you have that two-way exchange of information, both providing and receiving information to and from your project links? And have you started working with those project links to take action on community issues? And as you can see, each of these different dimensions, they build on each other. They're not mutually exclusive. And if you think back to that diagram with the green and blue circles, the concepts definitely, they build on each other. As you increase participation, you increase the ability to harness informal leaders. When you do that, you develop your leadership, often through building skills. And so each of them sort of rolls into the next. The last and important dimension that I'll talk about is sense of community. Through building trust with others, projects or networks can build a sense of community when people come together to work on shared problems. Collaborations give community members confidence to act and the courage to feel hopeful about change. So I'm sure this is something that you're all good at. And the question to ask yourself is, how does your work contribute to building a sense of community? And some common tools for this that you're probably familiar with are food, building time for relationship building, and just that opportunity to work together on an issue of common interest. So now I'm just going to head off and talk a little bit about this community capacity building tool, which was developed through a research project. And there was a core research team listed here, and we were lucky enough to find funding from what was then the Health Canada Office of the Chief Scientist, and we did a full ethical review of the project. And we're very fortunate to have community-based organizations and practitioners participating in each stage of the study. And our goal was to develop a tool that would measure the contribution of community-based funding programs to building community capacity to improve health. And just to remind, I guess I spoke to this a bit at the beginning, but we realized that most of our programs were trying to build some capacity in communities, but we weren't really sure, well, what does capacity look like? How would you know if it was being built? And so we brought together, first of all, as much literature as we could get our hands on, did a large literature review, and then we brought together Canadian academic experts, community practitioners with a lot of experience, and some policymakers all into one room for a national think tank. And we presented them with everything we found in the literature and asked them to identify what were the most relevant concepts for the Canadian community-based programming context, and what would be the key indicators that would be universal, that would cut across projects. And so they worked their way through the key aspects of the literature and provided us with recommendations. And then we drafted and focus tested and pilot tested the instrument. So the tool is divided into 9 scales that reflect those, we call them domains, that I've just talked about: participation, leadership, community structures, etc. And the tool allows individual projects to document both actually I'll click to the next slide. I'm going to go one further. No, I want one more. Sorry. Okay. So here's an example of what the tool looks like. It has a 4-point sort of little rating system, but it also allows projects to provide descriptions so that they can write down why they chose their answer, so that they can collect both qualitative information and also easily quantified information. So now I'm just going to jump back a few slides to applications. And, nope.
The applications one is up.
Thank you.
You're welcome.
So the tool's been used for teaching the concepts of community capacity. So if you wanted something tangible you could take back to your organization or members of your network, you could download the tool just to walk through each of the concepts together as a group. It's also been used as a planning tool because if you're thinking ahead about an initiative or project, it helps you think about all the dimensions that you might want to consider building into your design. It's also been used as a pre-post assessment, either by individual projects at time 1 and time 2, or multiple projects and sites. And when it's used by multiple projects, obviously you can then start to develop sort of a quantitative picture of how things are moving. And when we analyze CE data at the Public Health Agency of Canada, we know that projects are going to move forward and backward in time. We don't expect a straight linear progression, and that's an important thing that we try to communicate when we use it, because some of our funding programs actually use it as one of their key measurement tools. Okay, so on to uses. The tool so far has been used in Korea and Zambia, the United States and Canada, and there may be other countries, but I can't say with confidence that it's definitely been used. So these are the ones that have written to me to get permission or to, let me know about their use of it. It's open to anyone because it's downloadable off the web, so people actually don't need to ask for permission, but sometimes people do it as a formality. The tool's also been adapted to measure policy influence and to assess capacity for community economic development, and it's also been adapted to assess the Urban Aboriginal Strategy Community Steering Committees. So it's been used in a lot of different ways already. So we already took a look at an example of 2 questions in the tool, so I won't do that one again. But if you did want to download it, this is the website where you can access it in French or English. And if you need more information about this, you're welcome to contact me at the Public Health Agency of Canada. So I invite you now to use that Q&A function if you have specific questions that you'd like me to answer. And using this URL on the screen, I really, really encourage you to consider clicking on that link and answering the following evaluation questions. You know that I'm an evaluator, so collecting evaluative information is near and dear to my heart, and I would really appreciate any feedback you have that would help me to be more effective in delivering this kind of information. And so I'll just click on those Q's and A's again and see if there's any specific questions you have. I don't see any. So thank you for taking the time to listen to this presentation, and again, I hope you'll take a few moments to answer the evaluative questions there in the post-survey.
Thank you, ladies and gentlemen. That concludes this webcast.